When it comes to treatments that promise to rejuvenate your skin, my next guest has seen them all, and she certainly knows what does and what does not work. So when Dr. Ann-Therese Stubbs is extremely excited about a new treatment, it's definitely worth taking note. And Dr. Stubbs joins me once again. Dr. Ann, it's nice to have you here.
Nice to see you.
This is something new. Hadn't heard of it before, so I'm so excited you're bringing it to our viewers. What's it called?
It's called the 3-step ZO chemical peel, and ZO stands for Zain Obagi. Dr. Zain Obagi is a famous dermatologist in Beverly Hills who produced a line of skincare products called the Obagi skincare line.
Many people are familiar with.
A lot of people are familiar with that. He's got a brand new line called ZO, and this is his in the doctor's office chemical peel that's giving us astounding results.
What would it be used for, this chemical peel?
Well, chemical peels in general take off the top couple layers of the skin. This one, however, has some retinol involved as well, and so it can treat melasma, which is pigment on the skin resulting from hormone changes. Some people get pigment on the skin after pregnancy or being on birth control pills or any kind of hormone pills. So melasma is something that it treats. It treats acne, it treats fine lines, wrinkles, and just gives an increased tightness and turgor to the skin.
How does it work, and how does it different than other peels the way they've worked?
Typically, chemical peels are kind of chemicals painted on the skin. It kind of has a little tingling and almost a burning sensation. And based on the level of acid and how much acid is in it, it can peel off 1 or 2 microns or a large amount of the skin, depending on if it's a medium level or deep level peel. This one, the first step is an exfoliation. Basically, an acid is placed on the skin, a light acid that just kind of tingles a little bit, and that's the exfoliation process. The second step is the retinol cream, and that's the one that really penetrates down to the deep dermal level, and that tightens skin. And retinol is basically retin A, which is vitamin A for the skin topically, and this penetrates deeper because the top layer's already been exfoliated. And then the third step is a calming cream that calms down all the redness or inflammation. So patients really are very comfortable and leave the office very comfortable. Over the next few days, they start to flake and peel a little bit, but it can take pigment off. Definitely brings up brand new skin cells that are much tighter and firmer, and evens out skin texture and turgor too.
We have some before and afters, and those always are really good to show folks. You're getting good results already from this, so
even
you're
after one peel, we can see a definite difference, and I think in this one you can definitely see a difference in the pigment.
Yes, very much.
That has left, and I hope that the viewers can also see just that the skin texture is smoother as well. The beauty of this peel too is it can be used on all different skin types, very light fair skin to very dark skin as well. And this one, again, some profound results just with the pigment, and that was kind of melasma type pigment. This is a darker skin individual who also got some great results with the pigment being lifted, just an evener skin tone, and also just the tightening, and the pores look smaller, and the skin is tighter.
You explained 3 steps. Are those all done at the same time, Dr. Ann?
Just in sequence. So first the esthetician cleans the face, and the first exfoliation solution is painted on the face, and that stays there about 2 minutes. And we have a beautiful machine that blows cold, cold air, and so most chemical peels are done with just a little fan blowing on the skin, and this is kind of a high-powered, what we call a Zimmer, and we use it for some of the laser peels too. So patients are very comfortable. They get to hold that cold air right up, and so the tingling goes away very quickly. And then the next layer that's kind of painted on the face is the retinol cream, and that is what really penetrates down and does the tightening. So retin A, we've known for years that retin A is a wonderful rejuvenation for the skin. You'll see it in all the over-the-counter products as well. Retin A is one of basically the best anti-aging things you can do for your skin. I tell my patients, even if you can only get it on your skin once or twice a week, you're doing something good for the anti-aging process.
How much will there be downtime with this one?
Well, usually I tell patients 2 to 3 days. Everybody's different. Some people peel a little bit more. Sometimes if people have been preparing their skin, have been on good skincare products, and there's a level of exfoliation going on a daily basis, those folks can sometimes peel a little bit more just because they get a more profound kind of penetration of the chemical.
Well, you are so excited about this that you have a special, your deal of the week is this product, this procedure rather.
We do a deal of the week every week, and this is half off this week. So normally it's a $300 peel, and this week it's $150. So some people do them in sequence too, maybe 3 or 4 of them getting ready for a wedding or a special event. They'll do one every 3 to 4 weeks, and that can be a wonderful change in your skin.
Well, I bet you would see a difference doing it like that.
Huge difference, yes.
Well, the information's been on our screens. Dr. Ann, thank you so much for introducing us to this new procedure.
Thank you.